A new clue in glaucoma. Leaky blood vessels may damage vision. Glaucoma is known as the silent thief of sight, slowly damaging the eye's nerve cells and causing vision loss. Today, new research hints at surprising factors that could help protect vision or even restore it. In April 2026, scientists reported several findings that may affect how we understand and treat glaucoma. These include a study linking leaky tiny blood vessels to nerve damage, a tested drug, BOE10635, that helps keep nerve cells alive, and an artificial intelligence (AI) tool to catch glaucoma earlier. We'll explain each in plain language, note how close they are to helping patients, and give each finding an importance rating 1 to 10 for the big picture. We'll also briefly mention a January 2026 study on a protective enzyme, GPX4, from past news. Leaky retinal blood vessels and glaucoma. Importance 6/10. One new idea is that damage to small retinal blood vessels might contribute to glaucoma. Normally, the tiny blood vessels in the retina have tight barriers that keep fluid and cells from leaking into the delicate nerve layer. But if this blood-retinal barrier breaks down, harmful substances or immune cells could slip through and hurt the retinal ganglion cells, RGCs, the nerve cells lost in glaucoma. A recent lab study found evidence for this effect. In experiments on mice, researchers showed that removing certain immune cells, microglia, caused retinal vessels to become leaky after injury. This leakiness allowed inflammation in the retina and actually reduced the ability of nerve cells to regrow their connections. In other words, when the blood vessels leaked, nerve repair was worse. The study highlighted that keeping the vessels sealed is important for nerve protection. It's important to note this was early lab work in mice, looking at injury models, not human trials. Still, it suggests that future glaucoma treatments might also aim to strengthen vessel barriers or control inflammation. Despite being only in the lab so far, this finding is interesting because it adds a new clue to what makes glaucoma worse. Rating about 6/10. It's an early discovery that opens new research ideas, but far from direct patient treatments. A healthy blood-retinal barrier has long been known as critical in diabetes and retinal diseases, and now it's being studied in glaucoma too. Drug WEI10635 protects nerve cells. Importance 7/10. Another April 2026 result came from a drug screen on retinal nerve cells. Scientists tested a series of compounds on human-like retinal ganglion cells grown in the lab. They found that WEI10635, a drug originally studied in the brain, helped these glaucoma-vulnerable nerve cells survive and function better. Specifically, the drug boosted the cell's energy factories, mitochondria, and reduced their suicide signals. The study, published 2nd of April 2026 in Communications Medicine, used both cell cultures and mouse models of optic nerve injury and glaucoma. When mice were given WEI10635, their retinal ganglion cells were better protected after damage. Importantly, treated mice kept more of their vision. Tests showed their eyes could still send signals to the brain with much less loss. In simple terms, WEI10635 acted like a neuroprotector, helping the cells live through glaucoma stress. This research is exciting because WEI10635 is already a well-known drug. It blocks a serotonin receptor called 5-HT1A and has been safely used in other studies. However, the results are all from lab and animal studies. We don't yet know if it will work in human glaucoma patients. Clinical trials are needed, and that could take years. Still, because the drug is already known, moving to human tests might be easier than a brand new chemical. Rating 7/10, quite promising for neuroprotection, but still preclinical. In plain terms, imagine an existing drug reloaded to protect the eye's nerves. It's hopeful, but not ready yet to film a family trip or read again. AI to predict glaucoma early. Importance 7/10. Glaucoma often goes undetected until it's advanced. New technology may change that. Researchers have trained artificial intelligence AI systems to spot very early changes in the eye that predict who will develop glaucoma. For example, one study developed a deep learning model using tens of thousands of retinal photos. The AI learned patterns invisible to the human eye and could predict which eyes would turn into glaucoma within a few years. The system achieved very high accuracy, area under the curve 4.90, in validation tests, meaning it correctly identifies most at-risk patients. Remarkably, the researchers noted that their AI could even be used via a smartphone camera to screen patients in clinics or remotely. What does this mean? In the future, an eye doctor could snap a photo of your retina, and the AI would flag if you are at high risk for glaucoma before any vision loss occurs. Early detection is valuable because treatments, like eye drops or laser, could then be started sooner to prevent damage. However, this AI is still in research stages. One key study was published in 2022. It needs more trials and approvals before it's a routine tool. Rating 7/10, high potential to save vision through early action, but still developing. For patients right now, AI means hope for better screening in the future, but it doesn't change today's care yet. It's similar to having a helpful assistant that catches risks early but isn't in all clinics yet. Background: GPX4 and nerve protection, Jan 2026. Before these April updates, another piece of news came in January 2026 about a protective enzyme called GPX4, glutathione peroxidase 4. Scientists found that in mouse glaucoma models, cells that naturally survived stress had higher levels of GPX4, and giving mice extra GPX4 helped their optic nerve regenerate. In simpler terms, GPX4 fights harmful oxidants, lipid peroxides, that can kill cells. The study showed that boosting GPX4 let many retinal ganglion cells and their axons survive after injury. This suggests GPX4-related drugs or antioxidants might someday be used to help protect or even repair the optic nerve. But again, this is lab research in mice, published Jan 2nd, 2026. It's an exciting clue, like discovering a shield in cells, but it's still a long road before any treatments for people. Importance: toward 8/10 for future vision restoration research, but very preliminary. What this means for patients right now. Each of these updates gives hope, but it's important to be realistic today. None of these findings is a new treatment you can get yet. Blood vessel study, leaky vessels. This adds to scientific understanding. It won't change your eye care immediately, but in the future, doctors may pay more attention to inflammation or blood flow in glaucoma. WEI-10635 drug, still in experiments. Researchers are enthusiastic, but it's not prescribed for glaucoma patients now. If further tests in animals and then humans are successful, it could become a supplement to pressure-lowering drops. For now, stay on your current prescribed treatments. AI early detection. This could significantly help in the future by catching glaucoma even before obvious signs. However, that technology needs more testing and FDA or other agency approval. In the meantime, patients should continue regular eye exams. AI on your phone isn't available at the optometrist yet, though it may come in a few years. GPX4 research. This is another lab discovery, not a human trial. It suggests someday drugs targeting oxidation might help nerves, but that's still in the future. Right now, antioxidants, like those in a healthy diet, are generally good, but there's no GPX4 pill or gene therapy for glaucoma yet. In summary, these studies mostly point toward future possibilities. They are early stage. Think of them as clues in a puzzle. The only proven steps today remain lowering eye pressure as your doctor advises, drops, laser, or surgery, and monitoring your vision routinely. Are we closer to regaining lost vision? The ultimate question is, can these findings help restore the vision that glaucoma has already taken? Unfortunately, we must be honest, not immediately. All the latest research is on protecting or preserving the remaining nerve cells or on catching damage earlier. None of it has yet shown actual vision return in patients. Here's why. The WEI-10635 drug preserved function in mice, which is great, but human trials are needed. Even then, protecting neurons usually means stopping further loss rather than fixing what is gone. The AI tool helps with early detection, meaning treatments can begin sooner. That helps keep vision from getting worse, but again, it doesn't restore lost sight. The leaky vessel concept and GPX4 work are about understanding damage and potentially coaxing nerve regrowth in mice. They suggest that maybe one day we could promote actual nerve repair. But it's not here yet. In other words, we are slowly building the science needed for true restoration, but it's likened to climbing a very tall mountain. Each step, like these studies, is progress. We can now hope that one day these directions will lead to therapies that regenerate nerves or rewire the visual system. For now, though, focus on preserving what vision you have through proven treatments and healthy habits. Bottom line for patients: April 2026 research brings interesting leads and reasons to be hopeful about the future. But these updates do not change your immediate care. Continue your current treatment plan to control eye pressure, follow your doctor's advice, and have regular checkups. Think of this news as a sign that scientists are working 24/7 for new answers, a comforting boost for the long run, even if today's action items stay the same. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.